Hello guys, welcome back to my channel. Before we start the video, please do subscribe my channel which is Mat MCQ and Notes, and also do like, comment and share. Our today's topic is scapula. The scapula is a thin bone placed on the posterior lateral aspect of the thoracic cage. The scapula has two surfaces: dorsal surface, also known as posterior surface, and costal surface, also known as anterior surface. Three borders, three angles and three processes. Now, side determination. The lateral or glenoid angle is large and bears the glenoid cavity. This is glenoid angle and it bears the glenoid cavity. The dorsal surface is convex and is divided by the triangular spine into the supraspinous and infraspinous fossa. Now, the costal surface is occupied by concave subscapular fossa to fit on the convex chest wall. The thickest lateral border runs from the glenoid cavity above to the inferior angle below. So, the lateral border is the thickest of all borders. Now, surfaces. The costal surface or subscapular fossa is concave and is directed medially and forward. It is marked by the three longitudinal ridges. Another ridge adjoins the lateral border. This part of the bone is almost rod-like. Okay, it acts as a lever for the action of serratus anterior in overhead abduction of the arm. So here a question may be asked that which muscle help in the overhead abduction of the arm? Serratus anterior. Now the dorsal surface gives attachment to the spine of the scapula, which divides the surface into a smaller supraspinous fossa and a larger infraspinous fossa. Smaller supraspinous fossa and a larger infraspinous fossa. The two fossae are connected by the spinoglenoid notch, situated lateral to the root of the spine, somewhere present here. As you can see in later's diagram, notch connecting supraspinous and infraspinous fossae. You can easily see it when you have bone in hand. Now, borders. The superior border is thin and shorter. This is superior border which is thin and shorter near the root of coracoid process. This is coracoid process. It presents the suprascapular notch. As you can see in Nater's diagram, this is superior scapular notch or also known as suprascapular notch here. Now the lateral border is thick as we have discussed before. At the upper end it presents the infraglenoid tubercle. At the upper end it presents the infraglenoid tubercle, as you can see here in Nater's diagram, or you can see over here also. This is infraglenoid tubercle and this is our lateral border. Now the third point is the medial border is thin. This is the medial border, it is thin and it extends from superior angle to the inferior angle. Now, angles. The superior angle is covered by the trapezius. This is the superior angle, it is covered by trapezius. The inferior angle is covered by the latissimus dorsi and it moves forward round the chest when the arm is abducted. This is the inferior angle and it is covered by latissimus dorsi. The lateral or glenoid angle, this is the lateral or glenoid angle which bears glenoid cavity. It's broad and bears the glenoid cavity of fossa which is directed forward, laterally and slightly upward. Now, processes. The spine or spinous process, this is spine, also known as spinous process, is a triangular plate of bone with three borders and two surfaces. Three borders and two surfaces. It divides the dorsal surface of the scapula into the supraspinous and infraspinous fossae. Its posterior border is called crest of spine. This is called crest of spine and it is divided into upper and lower lip. Okay? The acromion has two borders, medial and lateral. This is acromion and it has two borders, medial border and lateral border, and two surfaces, superior surface and inferior surface, and it has a facet for the clavicle. The clavicle attaches with the acromion process of the scapula to form acromioclavicular joint. Now the third point is coracoid process. Coracoid process, it is a finger-like projection on the scapula. It is coracoid process, as you can see here. is directed forward and slightly laterally. It is bent and finger-like. It is atavistic type of epiphysis. Attachments. The multipennate subscapularis arises from the medial two-thirds of the subscapular fossa. This is medial two-thirds of the subscapular fossa, originating subscapularis muscle. You can appreciate subscapularis muscle here. This is subscapularis muscle supplied by three nerves, which is upper subscapular nerve, middle subscapular nerve, also known as thoracodorsal nerve, and lower subscapular nerve. Now the second point is the supraspinatus arises from the medial two-thirds of the supraspinatus fossa, including the upper surface of the spine. This is supraspinatus fossa, originating supraspinatus muscle. Supraspinatus muscle you can see over here. This is supraspinatus muscle, or you can appreciate here also. This is supraspinatus muscle. Now the third point is the infraspinatus muscle arises from the medial two-thirds of the infraspinatus fossa, including the lower surface of the spine. This is infraspinatus fossa, originating infraspinatus muscle. You can appreciate here, this is infraspinatus muscle. Now, the deltoid arises from the lower border of the crest of spine. This is lower border of the crest of spine. And from the lateral border of the acromion. This is the lateral border of the acromion, originating deltoid. You can appreciate deltoid muscle here. This is deltoid muscle. The acromial fibers are multipennate. The trapezius is inserted into the upper border of the crest of the spine. The trapezius is inserted into the upper border of the crest of the spine. This is upper border of the crest of the spine. And into the medial border of the acromion. And into the medial border of the acromion. Trapezius is inserted over here. You can appreciate trapezius muscle here. This is trapezius muscle. The serratus anterior is inserted along the medial border of the costal surface, 1 digitation from the superior angle to the root of the spine, 2 digitations to the medial border, and 5 digitation to the inferior angle. This is the medial border, this is the costal surface of medial border, and insertion of serratus anterior. You can appreciate serratus anterior muscle over here. Now, the next point is the long head of biceps brachii arises from the supraglenoid tubercle and the short head from the lateral part of the tip of the coracoid process. Supraglenoid tubercle is present over here and originating long head of biceps brachii, while short head arises from the tip of coracoid process. This is tip of coracoid process. You can appreciate long head of biceps brachii over here and short head of biceps brachii over here. Now the next point is the coracobrachialis arises from the medial part of the tip of the coracoid process. This is tip of the coracoid process and this is medial part of the coracoid process where coracobrachialis arises. Now this is coracobrachialis muscle. As you can see, this is coracobrachialis muscle. The pectoralis minor is inserted into the medial border and superior surface of the coracoid process. This is the medial border and superior surface of the coracoid process, and this is pectoralis minor muscle insertion. Now, this next point is the long head of triceps brachii arises from the infraglenoid tubercle. This is infraglenoid tubercle originating long head of triceps brachii. This is long head of triceps brachii. Now, the teres minor arises from the upper two-thirds of the rough strips on the dorsal surface along the lateral border. This is lateral border, this is dorsal surface of the scapula, and this is originating teres minor. Now, teres major arises from the lower one-third of the rough strip on the dorsal aspect of the lateral border. This is teres major. You can appreciate teres minor. This is teres minor and this is teres major muscle. Now, The levator scapulae is inserted along the dorsal aspect of the medial border. This is dorsal aspect of the medial border. This is levator scapulae from the superior angle up to the root of the spine. This is superior angle and this is the root of the spine. This is levator scapulae insertion. You can appreciate this muscle over here. This is levator scapulae muscle. Now, the rhomboid minor is inserted into the medial border of the dorsal aspect opposite the root of the spine. This is the medial border and this is root of spine. Opposite to it, insertion of rhomboid minor. This is rhomboid minor insertion. You can appreciate this muscle over here. This is rhomboid minor muscle. Now, the rhomboid major is inserted into the medial border dorsal aspect between the root of the spine and the inferior angle. This is root of the spine and this is inferior angle. Between this, insertion of rhomboid major. And you can appreciate this muscle over here. This is rhomboid major muscle. Okay, this is rhomboid minor and this is rhomboid major. Now the next point is the inferior belly of the homohyoid arises from the upper border near the subscapular notch. You can appreciate in this diagram. This is homohyoid inferior belly. This is suprascapular notch. Okay. You can appreciate this muscle over here. This is homohyoid muscle. Now the margins of the glenoid cavity gives attachment to the capsule of the shoulder joint and to the glenoidal labrum. The margins of the facet on the medial aspect of the acromion give attachment to the capsule of acromioclavicular joint. This is acromioclavicular joint capsule. The coracoacromial ligament is attached. This is coracoacromial ligament attached to the lateral border of the coracoid process. This is lateral border of the coracoid process and to the medial side of the tip of the acromion process. Medial side, and this is the tip of the acromion process and this is the coracoacromial ligament. The coracohumeral ligament is attached to the root of the coracoid process. This is coracohumeral ligament and it is present to the root of the coracoid process. This is coracoid process, root of the coracoid process, coracohumeral ligament. The coracoclavicular ligament is attached to the coracoid process. This is the coracoid process and this is coracoclavicular ligament. The trapezoid part on the superior aspect. This is the trapezoid part and the conoid part near the root and this is the conoid part. The transverse ligament bridges across the suprascapular notch. This is the transverse ligament and suprascapular notch and converts it into a foramen which transmits the suprascapular nerve. The suprascapular vessels lie above the ligament. The spinoglenoid ligament may bridge the spinoglenoid notch. The suprascapular vessels and nerve pass deep to it. Ossification. The scapula ossifies from one primary center and 7 secondary center. The primary center appears near the glenoid cavity during the 8th week of development. The first secondary center appears in the middle of coracoid process during the first year and fuses by the 15th year. The subcoracoid center appears in the root of the coracoid process during the 10th year and fuses by the 16th to 18th year. The other center, including the 2 for acromion process, this is 2 for acromion process, and 1 for lower 2/3 of the margins of the glenoid cavity, 1 for the medial border, and 1 for the inferior angle. 1 for the inferior angle. Appears at puberty and fuses by 25th year. 1 for the lower 2/3 of the margins of the glenoid cavity and 1 for the medial border and 1 for the inferior angle. appears at puberty and fused by the 25th year. The fact of practical importance is concerned with the acromion. If the two centers appearing for the acromion fail to unite, it may be interpreted as a fracture on radiological examination. In such cases, a radiograph of the opposite acromion will mostly reveal similar failure of union. Now, clinical anatomy. Paralysis of the serratus anterior causes winging of the scapula and the medial border bone becomes unduly prominent. This image shows winging of right scapula and medial border unduly prominent. And the arm cannot be abducted beyond 90 degrees because serratus anterior muscle helps us in overhead abduction. The scaphoid scapula is a developmental anomaly in which the medial border is concave. Now, thanks for watching. In the next video, we will be doing humerus, and please do like, comment and share. See you in my next video. Ta-da!